Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. So I was trying to think of my topic today, and it's interesting because after over 300 and some topics, I usually have one ready to go, and I always have it different or a variation of something I have done before, but still different. And it's interesting because I know I've talked about medical nutritional therapy before and some of the things, mostly in the setting of telehealth because it's on the list. But one of the things that happens a lot, and I don't know if this happens to you, but I'll get questions through my Coding Corner. And for those of you who don't know what that is an online coding service. And you can ask unlimited questions through email for a yearly fee. We have an executive membership and a regular membership. You can find it on my website at terryfletcher.net under services. But one of the things I find is that a lot of staff members will send over questions where they ask a question and I'm very clear that you cannot code for these services based on what you're sending over. And they're saying, okay, well, how can I code for them? Like, no, there is no getting around it. So, I know I talked about this before. Sorry, I've got a barking dog outside my window. Never barks until I go to record, right? But I keep getting these questions and it's like, okay, well, then I just have the last question. How do I code for this? I'm like, you can't code for it. How many times do I have to tell you? I mean, over and over again. So medical nutritional therapy visits, the 97802 to 97804 codes. Those codes are not for dietitians to use to, talk about weight loss surgery, for nutrition consult, for diet monitoring, learning assessments, reading labels, how to eat out, what to do with protein drinks and supplements. That's not what they're for when you're dealing with Medicare and many commercial plans and also Medicare Advantage plans, unless the patient has chronic kidney disease or diabetes. So if you're offering it and those diagnoses do not exist, you cannot report it, or you have to let the patient know that they're going to be responsible. I recently had a large group that tried to code these with a nurse visit, and they had to refund over $300,000 for incorrect billing. So we appreciate our registered dietitians, our nutritionalists, but they are for helping with quality measures, for QPP, for PQRS, for MIPS. But fee-for-service billing is tied, and let me be clear if you don't understand, diabetes diagnoses and chronic kidney disease. There are LCDs everywhere about this, and there's also a fact sheet on this. So you absolutely cannot code for it. And I've been dealing with this one, Coding Corner member, and I hope you're listening to this because I know the email back and forth. My last one might have gotten just a little bit, I don't want to say harsh, but abrupt. I'm dealing with this since July. And again, I'm getting the same question. We're still trying to solve our MNT problem. How should a nutritional assessment conducted by a registered dietitian for obesity surgery be conducted? And my response is you can't code it. Again, if that is not something that is agreed to be paid by the patient, if they don't have diabetes, if they don't have kidney disease, chronic kidney disease actually, then there is no service. So just because a CPT code exists doesn't mean that payment exists with it. You should know that. And so not everything is covered. And it's very frustrating when I think somebody keeps sending over things. And I understand the frustration within a practice where your doctor keeps saying, well, we want to do it. Go ahead and do it. But it's a cash service. It's a non-covered service. Patients will have to pay for it under the No Surprise Act. Remember, you're going to have to tell them because it's a non-covered service. They're going to have to sign a waiver. They're going to have to realize that these are not reimbursed services by insurance. So give it if you want, provide it if you want, but they may add value to your practice, but they're not revenue opportunities unless the patient has certain chronic conditions. And Google your national coverage determinations, your local coverage determinations. And I sent this over to this group. So I'm ranting a little bit because I don't know if they thought maybe give me a month and I'll say something different. My response is still the same. You can't bill for it. You just can't. You just can't. So unless you have those diagnoses. The Codecast podcast is also brought to you today by Vaseline Lip Therapy, aloe vera brand, Vaseline Lip Therapy. So a couple of things that I also wanted to bring to your attention since we got the code file for the 2024 CPT codes. I just want to give you just maybe a snapshot of what you'll be looking at. Please make sure that you follow my, fourth quarter Medicare update and also my CPT updates later this year. The fourth quarter Medicare update I have on October 17th through the nschbc.org and on the 12th, so this week, with McVeigh at mcveighseminars.com. So either way, you'll get at least a snapshot of this in writing. But our office visits, and other outpatient patient visits, 99202 to 99215, are being revised with the time. So right now it says, let's say just an example, the 215 will say on the time area, it'll say, when using time for code selection, 40 to 54 minutes of total time is spent on the date of the encounter. In 2024, they've revised it to say when using total time on the date of the encounter for code selection, 40 minutes must be met or exceeded. And then the next one gives you that maximum. So for example, on the 214, 30 minutes must be met or exceeded. Then 215, 40 minutes must be met or exceeded. So instead of giving you a range of 30 to 39, 40 to 54, they give you what has to be at least met before you can use time for that code. I think they're just trying to be consistent with how they did that for hospital codes. We had some additions to surgery. We also had an add-on 994959, an add-on procedure to a preventative service that is a pelvic exam. Okay, that's interesting. We had some add-ons for spine surgery, so make sure you're looking at 22836 to 22838 for interior thoracic vertebral body tethering, and then some revisions there as well. And we also had some revisions to some of the bunionectomy surgeries. So they used to say with bunionectomy, now they're just saying the hallux valgus is a bunionectomy. So they took out the word with. So whenever you see revisions, usually it's just a word or two, maybe a semicolon. They've added some nasal surgeries and some, they call it phrenic nerve stimulators. And so make sure you're aware of that. A lot of surgery codes added in the nerve stimulator, cystouroscopy. How about that? Trans-cervical ablation codes, skull-mounted cranial neuromuscular generators. So those are in the 60,000 codes. And we've had some radiology codes that have been added. So some epicardial cardiac ultrasound codes. They're adding once again for congenital heart disease. So just know that those are in the 76,000 codes. The non-invasive FFR, which was in the code set for T code, they've actually added that now in the radiology code section. Revise some path and lab. And let me see if there's more things here that I want to go over with you. So major surgery, let me just kind of go down here. A lot of path and lab U codes, so really looking at informational codes and making sure how to report those. Some medicine services had some added there for venography for congenital heart defects. Looks like in the radiology and some of the medicine section, they're really looking not only at nerve stimulators, but they're looking at more information for congenital heart defects on the venous side. So take a look at that. And since I'm cardiology, I'm going to have to deal with that as well. Some group caregiver training for activities of daily living codes have been added. So those are some interesting codes. I did also see that there are going to be some codes added for some sessions for mental health, but they're for providers that are not necessarily QHPs or MDs. But remember, just because codes are added, I was talking about this just recently, doesn't necessarily mean they're paid. It just means they've been added. We have a lot of T codes, new technology codes that have been added for different types of leadless pacemakers. T codes mean that they may be considered, but they're new technologies, so it's really payer driven. And just be aware of that. Okay, since I have so much terrible background noise today and my weekend is completely booked, which is when I record these, I'm going to go ahead and end today. You saw I had a loss with my Steelers last week, and this weekend we play the Ravens, so I'm a little bit crying in my soup, but pray for me. Hopefully at 2-2, we'll get to 3-2, but I'm not confident right now, but at least our quarterback isn't hurt. Anyway, everyone, make it a great day, make it a great rest of your week, and thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.